Thank you all so much for showing up this Friday afternoon right before a long weekend. It's very great to see everyone here. So this webinar is being hosted by Partners in Health Engage. We're the Santa Clara University chapter, and then the Tiba Foundation. So I'm Sophie, and I am the Director of Education and Community Building for the Santa Clara chapter of Partners in Health Engage. And I'm joined by Beth Williams, who is the president and team coordinator of our chapter. We'll save time for your kind of questions at the end. And we're planning to have this webinar last for an hour. So we have some prepared questions and then some audience questions. So I'm going to turn it over to Beth and Diane to introduce the organizations.
Great, thank you, Sophie. So I'm just going to give a little intro into Partners in Health Engage. So Partners in Health Engage is a grassroots organization off of the social justice nonprofit organization, Partners in Health. So Partners in Health works with sister organizations across 10 countries globally, from Haiti to Peru to Rwanda, to help bring the benefits of modern medical sciences to those who are most in need of it. So PIH emphasizes the importance of solidarity and works with those in the local communities to form hospitals, clinics, or whatever else is really needed in that area. So on a timely note, PIH have been leaders in the response to COVID-19 since they can leverage their experience in treating infectious disease outbreaks and responding to emergency situations around the world. So in addition to providing this expert care in the countries they work in globally, PIH is among 4 groups working to control and end transmission of the novel coronavirus in Massachusetts as a part of the Community Tracing Collaborative, and they're now offering assistance to help other states and organizations start up as well. So for us, as a chapter of Partners in Health Engage, what we do is we work to support PIH's work in a variety of ways. So we raise funds that directly go towards helping the communities where PIH works through a variety of fundraising events. We also advocate for the notion that the poor deserve equal access to high quality healthcare by writing letters to our representatives or meeting with our representatives to support certain healthcare bills that further our efforts. And finally, we raise awareness about the forces that prevent global health equity and highlight the links between poverty and poor health by watching documentaries, creating and presenting on this information, and doing webinars just like this one. So now I'll turn it over to Diane to give a little intro into Tiba.
Great, thank you. We are Tiba Foundation. We are so aligned with the values that you just heard presented with Partners in Health. And so I'm excited to do this with you today. So thank you. The Tiba Foundation focuses on support for healthcare and education in rural Kenya. And we were invited to participate with local Kenyans who realized there was a real need to get services in an area where there really were no services being provided. And their community donated the land and helped develop, with our support, a level 4 full-scale community hospital. And so in that hospital, which now serves about 30,000 people a year, there's outpatient, inpatient clinics, there's a OR that's in development, and a focus on community health programs, and especially focus on nutrition, in working with the disabled, and in family planning. And since we've begun, it's just amazing. With our partner is the Matibabu Foundation, and this began out of a relationship with Dan Ogola, who's the CEO there, and Gail Wagner, who is a Kaiser doctor here, now retired. And over the years, this has developed into a model of what can happen when people work together in partnership. So one of the things that's happened recently as well is that there has, Matibabu developed a nursing college. And so there's a real focus on training medical professionals. So it's actually a College of Health Sciences. The first program is the nursing school. And the nursing school has had 2 graduating classes with 100% of the nurses graduating and passing the national exams, and pretty much immediately being employed. And so building capacity of the local community, having local leaders is what we're so excited about. And during COVID, there are a growing number of cases in Kenya. And there's a real pivot that we're looking at. How do we make sure that we're focused on community health? as the solution for supporting the community to survive this and to go forward. So thank you so much. I'll be talking a little bit later about some opportunities, but that's what Tiba does.
Okay. I think, okay, so now we're gonna just introduce the people who are on the panel. So on the panel today, we have Dr. Bill Plautz, who's an Associate Medical Director for Kaiser Permanente, as well as a board member of the Tiba Foundation. In his free time, he is an avid kite surfer and an advocate for plant-based diets. And so we also have Diane Dodge, who's the Executive Director of the Tiba Foundation. And so she will be saying a few words at the end about how you can get involved in practical public health experiences, and Diane has helped thousands of college students finish their degrees and begin their careers. And so on the Santa Clara University side, we have Dr. Sheila Yuter, who's a lecturer for the public health program. Her focus is on healthcare strategy, business development, and program evaluation. She practices yoga frequently and enjoys supporting the arts through art and theater. And so also from Santa Clara University, we have Dr. Craig Stevens, who's a professor in the biology and public health departments. He's also the faculty advisor for the SCU chapter of PIHE. And so he loves to travel and has traveled to 4 out of 7 of the continents so far, hoping to get to the other ones soon. And so now we are going to start with some of our prepared questions. And so this first one we're going to ask all of the panelists to answer. And so the question is, given the coronavirus here and internationally, what do you think has fundamentally changed about our healthcare system that will continue? And how do we meet the new reality? And so Dr. Stevens, if you wouldn't mind beginning with your answer first.
Sorry, rookie mistake, but I shouldn't be a rookie at this anymore. Yeah, so I guess I would say 2 things. Here in the United States, I think one thing that has changed is, well, lots of things have changed, but one thing that may continue is an increasing use of telemedicine, which I think can really allow healthcare providers to reach out further and for patients to access healthcare in a more convenient way for them. So I would say that that is one thing here. I think internationally or beyond the United States, I guess in more low and middle income countries, I think it's ever more important. And I greatly admire Partners in Health. And now I'm a big fan of the Tiba Foundation too, because I think it's critical that we build capacity in every country. It's really important that we train people that live in those countries to be the next generations of doctors, nurses, community health workers, everyone in the healthcare system. We can't just do it from outside. It doesn't work to try and just, and in the political climate these days, it's harder and harder to reach out around the world. So capacity building, I think, is super important in those countries.
That's great. Thank you so much. Dr. Yuter, would you like to speak next?
Okay, so I agree with Craig that the whole area of telemedicine with all of its pluses and minuses is really something that I do want to mention as a sidebar, I do work for the county health system, so I've got sort of the insider information going as well as the broader perspective. And what we have found is that we've moved our primary care, we've moved our outpatient behavioral health to a telemedicine platform. And it's, of course, not ideal, but it's good, and our patients are adapting to it well. So that brings me to the second point that I think is a fundamental change. It's along the lines of what Craig was saying in terms of building capacity, but instead of just building capacity for the healthcare workers, the providers, it also means building capacity within communities. It means increasing our health literacy. It means understanding when to use the health system, when to pull back, and do some self-care, some management. It speaks to the prevention that we have to really amp up. It speaks to working within our communities to develop that kind of infrastructure and that health capacity to make us all healthier. So this is really a wake-up call to say, what happens when you can't go to the doctor because their office is closed, and maybe it's a small practice and they don't even have telemedicine for you. So it really starts to call upon us as communities to step up and to really broaden our efforts and really speak to the importance of public health in the community, not just in the delivery system.
That's great. Thank you so much. And Dr. Plautz, did you have anything to add?
Yeah, sorry, I had to switch positions because my phone is dying. Because it's true, everything we're doing now is virtual, and this has been a big change at Kaiser, and I think it moves us away from our focus of people come to us, we set up our shop, and that's how healthcare is provided. Healthcare is now in the community by necessity. And it's being supported, and doctors are very quickly pivoting to use new tools that they haven't before. Patients are adapting to that somewhat, but it demands a level of self-care for preventing COVID, but also self-care to engage in ways that are different than going to a doctor's appointment, going to a medical center, and sort of being a passenger in the care, to being a little bit more active in the decision-making about what is available in medical care and what is the responsibility of the individual and their community to provide. I'm hopeful that one of the things that we're going to see come out of this is an increased focus on the social determinants of health. I think it's yet to be seen if that's the case, but the COVID epidemic has really laid bare the disparities in health care and in health, and hopefully it will lead to action to address those in this new environment that we find ourselves.
Great, thank you so much, Dr. Plautz. Oh, sorry, go ahead, Dr.
Well, this is sort of
Yuter.
a follow-on with both of the comments, that one of the things that we talk about is working better as teams and working better interdependently. And one of the things this is really forced is to make that real, so that it's not just, well, the doctor in his role and the nurse practitioner in her role, but sometimes they have to step in and now back each other up and take that call, or be with a patient that they don't, a little bit out of their comfort zone. So this whole idea of the interdependence and the team and how people are communicating has really also been amplified.
Great, thank you.
Today we have a lot of students, health workers, and nonprofit professionals in the audience. How do they better prepare themselves to be the most effective in this new reality? What knowledge, skills, and experiences are key for their success? And so, Dr. Plautz, if you wouldn't mind starting on this one.
Okay, well, I think that epidemiology is becoming ever more important in addressing health issues. It's always been very important, but I'm not sure that public health students, take it as paramount in their training. It allows us to see the world and what's going on in a much better light, and not a reactionary way to dealing with one patient at a time, but kind of seeing the patterns of disease and the tools that come from the community rather than the medical and pharmaceutical toolbox to address those. And I think those are the most powerful tools that we have, the tools for prevention, the tools for self-care, and the tools for community medicine. So I think that public health training, I have both an MD and an MPH, but I really feel like the MPH is the much more valuable training that I had as far as background, because it gives me a perspective. Pretty much everything I've learned in medicine and that I use in the last 5 years, I didn't learn in medical school. It's been on the job, but the things I learned in public health school have really served me well to see things in a different light and lead groups of people who have tremendous skills and abilities, but maybe don't have that perspective to see what's going on. So I think, being in public health and paying attention to that, but I come to the same conclusion over and over. More and more medical technical skills, more and more sophisticated drugs and so forth only go so far in addressing the problems that people really have in the world. And I think where we're really going to make progress is on pulling the public health levers and looking at the social circumstances that lead to people's health. We can't fix everything that we cause, so we have to look at the causes of disease and work upstream. So that would be the direction I would steer people as far as their training. And I think probably this audience has made choices in that direction already.
Great, thank you. Yeah, definitely emphasis on public health. I might be a little biased, but I think it's very important. And so now, Dr. Yuter, would you like to respond to this as well?
Well, this is a great audience for public health, because I think we all are in that mindset right now. And as part of that public health, I would say don't be afraid of the numbers, because we have to be able to tell the story. And when we're working in communities, that's the guts of our work. But when we take a step back, we have to be able to tell the general public what it is that we're doing. What was our baseline? Where did we start? I know in Santa Clara County, we have the luxury of having a really robust public health department that has been able to tell us that, our growth rate in the number of cases, our mortality rate in the number of cases, we've all come to know how to talk about curves and other kinds of things that are top of mind. But as students and as trainees, we have to really know how to communicate that effectively so that the public does get on board and takes the necessary personal actions, but also takes the necessary community actions. So I can't emphasize enough the importance of just don't be afraid of those numbers. I know in some of the students that I work with, they feel the importance of health education, and they feel the importance of making a difference. But some of that really is getting the feel for how do we show everyone that we have made that difference. So that's a big push from my perspective, to make our case and to really make it clear that we have made a difference, whether it's because of the external things that have been done in testing or in treating, or it's because we have been able to shift people's behavior away from large community meetings and congregate meetings that we of course enjoy, but know that we just can't do it. Are we all wearing face masks when we're out in the public? Those are the kinds of things that make a difference, and that we can say as a result of our actions, here's how we have been able to change things. So I make a real strong case for that. I also say that coming out of all of that is an understanding among our generation and the next generation of public health folks to be able to learn from what we are experiencing now, to be able to say, well, this is what I've seen and this is what I recommend for changes for the future. How do we guide the future into a better future, whether it is fixing those social disability to help people to make that new world, make that next world, make that around the corner world, the world that we see as getting us to a new plateau.
Great. Okay, thank you, Dr. Yuter.
as someone who's had Dr. Yuter, I know she does very much emphasize the importance of numbers. So thank you so much for that great answer. And our third question is the next question we must ask ourselves as learning institutions is, how do we need to adapt ourselves here in the US and abroad to best develop the healthcare professionals that are needed? So we can start with Dr. Stevens on that one.
Yeah, that's a great question. I mean, preparing now for careers in global health is a little challenging because, you know, we're all kind of locked down in place. And to a certain extent, this may continue for a little while. So we may not be able to, you know, travel to far-flung places and experience global health issues firsthand. I would say that that makes it all the more important that we look around us where we're at. I mean, the San Francisco Bay Area has no shortage of health disparities. These are the, you know, for the same reasons, the social determinants of health play out here, just like they do in Kenya and in everywhere else in the world. And so I think that, you know, if you can't go somewhere else, then it's really important to be in the community where you're at to do what you can. In Santa Clara, you know, we have, Santa Clara County has tremendous health disparities. If you go from, you know, Palo Alto in the north down to Gilroy in the south and East San Jose and everywhere in between. I mean, the city of San Jose has a huge range. And so all of us have things that we can learn from getting out into our local communities. It's a little bit of a scary time to do that, but the need is tremendous. So if you can help at, you know, your local food bank, if there are things you can do to support people working with the homeless, all these things are ways of gaining deeper insights into those social determinants of health and learning what it means to work in community. Obviously, you need to take precautions. You need to protect yourself. You need to protect the people around you. But I think this is you know, this is a learning opportunity. We're always presented with learning opportunities. And so I think that we can use our local community to build our experiences in ways that will benefit you in the future.
Great. Thank you so much, Dr. Stevens. Great link to kind of reminding ourselves of what's happening locally here in the Santa Clara area. And then Dr. Plautz, did you have any thoughts also on that question?
Yeah, so, you know, I'm not an academic myself, but I have been following the initiation of the Kaiser Permanente School of Medicine, now called the Bernard Tyson School of Medicine in Southern California. I think it's opening later this year with the first class. But it's really a new approach to medical education that's grounded in population-based care, primary care, community health, social determinants of health, trauma-informed care, and really, you know, I think breaking away from the traditional model of systems and diseases, you know, as if everything is just a failure of some part in the body, but looking outside of the individual to the things that create the patterns of disease in society and the circumstances that lead to poor health. And I think will give a new generation of medical professionals a new perspective on solving those problems. The other perspective I have is working with our work in Kenya. And our work in Kenya very much started with the public health bent to it. It was an area where rates of HIV were extremely high. When we first started doing testing, 40% of the tests that we did would come back positive. And it's just coronavirus. You can't say that that's the prevalence in the community, but you can certainly say that that is a community that's been hit by HIV hard. And our first major one of our first major projects was organizing healthcare workers who organized volunteer community health workers to cover a huge area of Kenya with education about social practices that led to HIV. And it's really training girls in school and just a lot of things that have contributed to a dramatic decline in that number. And that approach, of all the things we've done at Tiba, I think is probably the one that's done the most. And so having started a school, being training nurses, these are all very important things. Not having health professionals is a fundamental disadvantage that's hard to overcome at all. But even having that, having the focus be on the community health is important. So we're trying, and perhaps later in this call or after this call, it sounds like there may be some expertise in Partners in Health. We're trying to pivot some of our staff and our training to things that are related to COVID, like contact tracing and the public health work that we need to do. So I think my hope is that these will forever become more important parts of healthcare training, but there are a lot of powerful political powers to overcome in achieving that as well.
Great, thank you so much for that answer. And yeah, it really is very important to keep in mind, public health when we're educating our medical professionals, and more of a global look at that. So our next question is, this is our last planned one, and then we'll have some audience questions. This question is, should we expect to see a dramatic shift in US and global public health policies as a result of this pandemic? And maybe we can start with Professor Yuter.
Yeah, I would like to say, and I want to be optimistic, that this is going to bring us together internationally. When you get a pandemic, it's not one country, it's not one culture, it's not one population. A pandemic literally is everybody's problem. So my hope is that this does give the impetus for more international work, more international cooperation, whether it's on the research side or it's on the deployment side. And that's an area that there is a lot of energy around, a lot of momentum around. And for the, of course, a tragic reason, because we do have a pandemic. But on the other hand, if that is what it takes to create the momentum, then a lot of good can come out of this. We can pool our research, we can pool our techniques, we can even pool our personnel. So that's one piece where I see this happening. The other is, and it kind of circles back to the earlier questions of, what do we need? What message do we need to get out to people, not only in this country, but everywhere? And it comes down to some very, very basic things. It has to do with basic hygiene. It has to do with basic health practices. And again, if those things can be disseminated widely with the idea that we are in this together, and we as a community, an international community, can in fact move that needle, and we can make progress as in our personal as well as our health system behaviors, we will have made huge progress. It's the health system that I think we have seen some inconsistencies. And there, because each country runs its own system or has greater control over the limits on its systems, where I don't see an awful lot of policy movement that would bring that world a little closer together. But I do see the sharing of practices across countries that, again, elevate to that policy level of how can we, in fact, learn from what other countries have done? How can they learn from what we have done so that we can share that and create that higher level of momentum and movement toward a safer place to be.
Great, thank you for that. Yeah, there's definitely a lot to be learned from other countries, and not every country has all the answers, but if we work together, that's more strength in numbers. So, and then Dr. Stevens, did you have anything to add to that question as well?
Yeah, I mean, just following on with what Sheila says, I think that, I thought that the world had learned its lesson over the last couple of decades as we've gone through, HIV and SARS and Ebola, that infectious diseases don't respect international boundaries. And the only way to deal effectively with the risk of global pandemics is through global cooperation. Unfortunately, right now, that message seems to be crashing head on into, nationalism and populism and other sort of trends, global trends that would have us being more isolated and sort of not cooperating internationally. But it can't be any more clear how critical it is for us to share information, for us to collaborate on, a global vaccine initiative, sharing testing technologies. There are so many tools that are being developed that it really doesn't make sense for each of us to act like we're an island unto ourselves. And so we absolutely need to get back to global cooperation and making global health all of our business, because the viruses and the bacteria could care less about how we divide ourselves up. In fact, that works to their advantage.
Perfect, thank you so much. So how do we help countries not only build the kind of physical infrastructure like clinics and hospitals, but also build the human resources to staff them from within and lead them?
So, I can talk from our experience in Kenya. We started out by providing facilities, for outpatient care, and have grown into providing facilities for hospital care. And hopefully in the near future, we'll have operating rooms and other sophisticated tools. But my fear all along from my first experience of going to Kenya over 10 years ago was that it's extremely fragile, because it's dependent on a few very dedicated people who kept things running, whereas international supporters, donors, visitors come in and out of the picture. And without that core group of humans to run things, things collapse very quickly. And over the course of those 10 years, we're able to start in parallel a School of Health Sciences, nursing, and we're training nurses, which are in extremely short supply in all of rural Kenya, but especially in the area that we're in. And yet it takes the synergy, because it takes the facilities and the places where the learning can occur in addition to the school to do that. But I think that having that combination and really leveraging the school part of it is going to be critical. And our organization right now is going through kind of a visioning process to say, where are we headed? And I think that we are headed more towards focused on education and dealing with the human resource parts of it. And, in my own mind, I have a series of about 5 training programs that we need to get off the ground in Kenya Unfortunately, in order to be successful, we'll have to do them one at a time sequentially, probably. But I think that that's really going to be the key to success. Buildings deteriorate extremely quickly, and equipment breaks, and without the people to hold things together and make things work, none of it works at all. And as we've learned through virtual care, we've had thousands of doctors working, basically not showing up to all the facilities that we built and providing a large portion of the care without those facilities. So it really is the training that's the critical element. There's need for facilities to support that, but the primary need is for training more healthcare professionals, and particularly with the right skill set.
Yeah, let me add on to that it's more than the high level professions. When I worked in Senegal, which is West Africa rather than East Africa, the big push was to have folks that were from the villages and were from the small communities be trained in basic work, and then be able to detect when someone needed higher level work, not have the same skill set as a nurse. Our village had a nurse practitioner, which is what we would call her today, who was absolutely amazing. But she took on the role of training people in the village to be able to go out into the smaller villages, to be able to then say, here's the basics, and come to me come to the community health worker, so that you can then get the next step if you need it. The same is true of some of the Latin American countries where you have the promotores that work so effectively in just detecting and referring, or teaching a whole lot of health education. And I want to point out just one other thing, which is we talk about resources and resource deficits, and especially in human resources. One of the things that I've seen has worked nicely is to get corporate backing, but long-term corporate backing, so that you have a system where you're not feeling like tomorrow the program's going to go away, that you have some kind of sustainability. So I know the huge corporations like Microsoft and Google do this, Unilever does this, and tapping into some of their programs and some of their energy and some of their wealth is another way to make sure that you have that sustainability.
I add on to something that Sheila was saying when she was talking about promotores and community-based health workers, because I see in the chat there's been some questions about how do we deal with intentional disinformation or conspiracy theories, things like that. And a lot of it's driven by social media, and it's very difficult to combat, and it can cause a lot of, it can be very dangerous in the time of a pandemic like this. But one of the ways to combat that, and it's not a total solution, but is to is to work in the community and work with people in the community and have trusted voices in the community health workers, the promotores. Right. They're getting out there and sharing information. People are more likely to believe something that they hear from a trusted peer or somebody that they respect. And it's a slow process to change everyone's mind that way. But that's really one way to go about it, is to work from sort of the grassroots level, try and get the accurate information out there and connect people to, through resources that they can directly access, people that they know, to, legitimate and helpful information.
Great. Thank you all for your answers so much. So we're about to go to ask Diane for some thoughts, but just quickly before we do that, to our three panelists, I just wanted to ask you, like, what do you hope we all take away from this discussion today? So just like a few, like just bullet points, like 3 sentences. If there's 3 things that we should remember, like what do you hope that we all take away from this? So I don't know, maybe Dr. Stevens, if you have an answer. Or
Yeah, I'm going to cheat and I'm going to say something that you haven't heard yet, which is for all of the Santa Clara students out there, and maybe for the other people too, because I don't know everyone who's listening in on this. One of the things we're going to need to do in order to reopen in the fall, if we actually do that, is we're going to have a rigorous testing and contact tracing strategy. And that's something that public health students can get involved in. They can actually be part of the on-campus public health workforce and be a contact tracer. There's some easy training that you can do for that, and it can really make a difference in helping us to potentially reopen and while minimizing the risk to the campus community.
That's great. It's a perfect opportunity for everyone and super important work. So thank you for that. And Dr. Yuter, did you have any key takeaways that you would like to mention?
Well, and again, I've been glancing through the chat as well, and this whole issue of disinformation, misinformation, viral information, all of that goes down to a very fundamental belief system. And I know sitting in with many physicians and with many behavioral health counselors, they face this every day, but they turn out to be authority figures with their patients, and they feel the burden of responsibility to make sure that the correct information is consistently transferred, and that when someone leaves, they will even go so far as to say, and will you please share the information we've talked about with your family, so that it is a version of the grassroots level of working one-to-one and then one-to-many to try and absolutely turn this tide of misinformation, disinformation, fake news that is working against the progress that can be made with public health messaging and with the clinical health messaging. So that would be sort of my plea, that folks not be discouraged or disheartened by what you're hearing, but rather step up and be more assertive in using your role and in using your powers in convincing your patients that there is real information, and that people have a responsibility to push back on it's not just the myths, it's on the intentional misinformation.
Great. That's a very important message. I definitely think it's easy to just sit here and be like, oh man, this is unfortunate, but to actually step up and take action is so important. And finally, Dr. Plautz, do you have anything else to add as key takeaways?
Yeah, and something that occurs to me about the misinformation is one of the byproducts of the internet and our connectivity, which is it's been very much a double-edged sword. But in the international realm, there has been a great deal of connection and leveling of the playing field by the same tools that have created some of these problems that we have to deal with. It really does come down to being able to discriminate what is good information and being able to share it with other people in effective ways that change health behaviors. And students can focus on that at all levels. And although the opportunities for traveling in global health are not, ripe right now, certainly when we think about using Zoom and other tools, it gives us a great opportunity to make inroads into global health for creative people who want to engage in sharing that information in effective ways. So I don't have the answer for the students, but I think that in order to be encouraging, is, you know, there are things that you can do, and you can figure out what they are, and they're not the old things. They're new things that we need to dream up and work through, study, and understand, and then put into play to make a difference in the world. And I'm encouraged the interest of people in doing that, and the hope that brings for the world.
Yes, that's great. And that leads perfectly to the next part. So in these last 8 minutes here, we're going to hear from Diane. She's the executive director of the Tiba Foundation, and she's just going to talk a little bit about opportunities for involvement, because I know we've had a lot of questions about like, what can we do now? So, go ahead.
Great. Well, thank you so much. And thank you, all of you, both our guests for what you have been sharing with us, and also for all of you who are students or friends of Tiba. You're all interested or working in healthcare or preparing, and it's a field that is so important now, and I hope you feel that appreciation and inspiration as you go into it. But let me ask you, how many of you would really like to have a summer internship or have an experience with global service internationally in your future? If you raise your hand physically or put it up in the chat, I think there's probably a lot of you, right? I had wonderful experiences like this, and most of us who are now in our careers can look back at how formulating these were for us. So if you are a established professional in your field, I'm going to ask that you, while I'm talking, would you think about what you could offer the many young people we have on our call, as far as opportunities to get involved, to get engaged, to learn and to serve. So I want to tell you a couple things about this. I've worked with a lot of college students over my career, and I think it's really important to actually get out and get your hands wet and do the work. So while you're going to school, actually get involved and do things. So I have to be honest, there's a couple things that are really important. One thing is, internationally at least, and even locally, there's been a lot of people who wanted to do well, and in the process, sometimes they actually hurt the cause they're fighting for, or they hurt their community. So I know you have great professors, you've heard about this. Just having a real awareness of, what am I showing up to do in this other country or in the homeless community or somewhere? And how can I be best prepared? And how can I be a true help, or come with a true learning heart? So I want to give you the challenges, and I'm going to tell you the good news at the end. The other challenge is, with COVID right now, there's not a lot of opportunities internationally. It's just not going to be happening. And the other thing is that when those opportunities do happen, you have to be prepared for them. So for example, some of the considerations that Tiba has, when we look at people who come on our line and they connect with us and they say, I want to volunteer, I want to go to Kenya to serve. Most organizations that really care about they've been thoughtful about the community they serve, they're going to send volunteers that community. For us, our partners in Kenya, who are they asking for? So our partners are mostly asking for medical professionals. So anyone who goes is going to be sharing something, or actually doing something, or providing capacity building and training for the staff there based on what our partners asked. We even get our doctors and nurses to get Kenyan medical licenses for their trips. So it's very, very important. We do at times send other people as well. But it's important to know that you're going somewhere, to a place that wants what you have to offer, and they need it. So you're not just there for the experience, you're actually there to give. The other thing that's really important is, unfortunately, we have to think about climate change. So you're right in the midst of it. You're young people, you're thinking about it a lot. When we travel, there are ways to offset our carbon footprint. And we do need to think about that, because the cost of going somewhere and spending that money, could that be used better somewhere else? I think on the long-term trajectory of your career, it's very important to see the world. It changes your perspective, it gives you different skills, and it's very important. But there are ways to do it, and think about that. So what I want to talk to you about is how to prepare. So I think that before someone goes on a trip in particular, they do need to be really understanding the place they're going. So I read an explanation that said you should spend at least half the number of hours or days that you're going to be in that other country. You should prepare yourself. So maybe months in advance, you're studying some of the language, you're learning about the culture. You've put all the Google keywords that give you the news questions on your feeder, and you're learning about them. So it's really important to learn before you go. I suggest you read some great books, and I already mentioned Paul Farmer when I was making a joke earlier that he was online. He has some great books to give you kind of the overall perspective of what's happening health-wise in our world. But the most important thing you can do right now is to get connected to your local community and get involved here. So I want to tell you a few people, and I'm just going to have you, if you would just raise your hand, or if you're going to come up here, be ready on your video. These are people who have demonstrated how to get involved, and they're young people. So when this COVID thing came up, I realized, wow, there's going to be all these amazing college students who are going to be at home. They don't have to do a lot of things that they used to. They can have more time. I want to get some interns to help move Tiba forward during this time. And we had 4 wonderful people. So the areas that they came to us, and a lot of the nonprofits and local organizations, they're not advertising for interns right now. They're not thinking about it. You just look at what are you passionate about, start there, and then offer yourself and see what's going on. For example, most people right now, most organizations need communication support. Social media ambassadors. We've just been talking about the media. So Ari and Wayne, I think you guys are both on here. You say hi. Have joined Tiba to do that. There's Wayne. Wave your hand, Wayne. Here, I'm going to mute you. Say hi so people would say, see you.
Hi, guys.
So Wayne, I'm just going to tell them. So one of the things is social media. I don't have much time here. So social media, research, joining professional groups for young professionals, and partnerships, okay? So Wayne he's doing social media for Tiba. He also took on a partnership project. I said, Wayne, we heard from our friends in Kenya that they needed soap. Can you figure out how to get soap? And we can't send it from the United States there. Wayne figured out that there were some hotels and some people who worked at these places who would give soap and deliver it from Nairobi to our village area. That's amazing. Okay, so sometimes it's a partnership. Another person, Gwen, is online right here. I'm going to just go on a couple minutes here. Gwen, say hi. So that way people can see you. Gwen worked for an organization called Days for Girls in Colorado. And she applied to come with Tiba to Kenya, and we accepted her because she already had that local experience. When she came, she taught about menstruation to girls and even to boys there in Kenya. And what you want to have happen is that it becomes, if it's interesting and important to the group there, that the local people and the local professionals will get involved and carry it on. And that's what's going on. So Gwen's a wonderful example of that. And then 2 other examples, for example, Beth, who is moderating, is an intern for Tiba. She has the club there at Santa Clara. And together, she said, let's do this event. It's a wonderful partnership opportunity for Tiba. You could offer that to many different places. She also is doing research for us about colleges in Kenya, because we want to learn how are various colleges growing, how do we make ourselves unique. And then one other group I want to mention, it's very important, 2 other groups. One is, make sure you tell your professors if you want to do research. I have a friend, Michael, he posted, Michael Amser, about a project he's doing. There's a lot of people who are coming up with research studies. And he went and reached out to people at a major university and said, I need some researchers and I need students to help. I need people involved. And the professors connected him with a lot of people. So let people know what you're looking for. If your thing is communications, is research, if you can do development and help raise money, if you have that on your resume and you're equal to someone else in your future, but yours says that you raise some money for someone that is going to make you be considered. So always think about that. And one last plug I need to say is that the United Nations San Francisco has a group called the Young Professionals Sustainable Development Goals Group. And it is a fellowship. My mentee's on the line. Hi, Zoe. If you are a professional in the area and you would be willing to be a mentor, it's a wonderful program. It's really networks people so that you learn about opportunities, you can connect to other people. And I think each one of the fellows who have gone through it are just incredibly strong and ready for their next steps. So those are a few ideas. I put all of them in the chat for you. I love to talk to college students about their career paths. I hope that the people who've been a long time in their career are thinking about how they could bring the next person along. It's such an important field that we need to help each other out and get there. So I just want to thank all of you for your time here. And if you want to reach out to me personally, I put my email in there. You can find me on LinkedIn. I'm happy to talk to you personally. Thank you so much.
Diane?
Yes.
Diane, before we close?
Yes.
I would like to encourage a specific opportunity that's timely and meets an immediate need. And, you know, I've asked the people in Kenya to think about what would be a program to train contact tracers in Kenya, which is, it's a health professional job. It doesn't require a great deal of background and training. And I've offered to support this financially, as have other members of our board. And if there are people on this call who would like to work on a distance learning package to create that training and help, you know, work on the other end of this to assist them, I think we can get the people in Kenya to be trained and create a public health tool in a rural area very quickly and very timely. So if there's anyone interested in doing that, please contact Diana, and we'll make it happen. And I think it is something that is feasible. I think we can make it happen, and I'm willing to support anybody who's interested in such an effort.
Great, that sounds like
That's
a
fantastic.
So yeah, I just wanted to say on behalf of the Tiba Foundation and Partners in Health Engage Santa Clara University, we just wanted to thank you all for participating and coming up to our webinar today. Also a huge thank you to all the panelists who have taken time out of their schedules in order to speak with us today. All your comments were super engaging and helpful as we all face the impacts that COVID-19 has on all of us. If you have any questions about the Tiba Foundation, Diane would be very happy to answer them. Her email, I just sent it in the chat, but it's diane.dodge@tibafoundation.org. And if you're interested in learning more about Partners in Health or joining our chapter of Partners in Health Engage, please email SCU@gmail.com, which is also in the chat. We welcome anyone who wants to help us further the right to health movement. So thank you all so much again, and we hope that you have a fun and safe Memorial Day weekend.
That's great. Thank you so much, Beth and Sophie, and all of our guests.